How many of you know what birth control is? I'm sure we all know or have a little idea of what it's intended for, but I bet we do not know what it is doing to women's bodies. Birth control could affect yourself, your mom, your sister, or any loved one. Birth control is extremely important to women, of course, but also men that do not have the correct education to what this is doing to the people they love and care about. Everyone in this room is either a woman or knows a woman who has heard or even experienced being on birth control and the side effects. And it is important to know what this can do to women's health. According to the Center for Disease Control and Prevention by Kimberly Daniels, states 65% of women aged 15 to 49 are currently using contraception like birth control. That is more than half of women that can experience negative consequences from birth control. During this, I want you to think of your loved one that might be going through similar experiences or symptoms, and think of a way you can better understand and take a step of action to help them. In order to understand what you might be experiencing or your loved one might be experiencing on birth control, I will discuss the physical and mental side effects it has on women's bodies, the lack of women's research, and how to advocate and speak up for yourself or your loved ones in a medical situation like this. To begin, birth control has led to many physical and mental side effects on women's bodies. Birth control is mainly used to prevent pregnancy. That's why many women decide to take birth control at the start. But what they don't know is the toll it can take on not only their physical health, but their mental health as well. According to Healthline.com, the article, The Effects of Hormonal Birth Control on Your Body, states a 2023 study found that the pill users may face up to 130% risk of depression, and the pills which contain synthetic versions of estrogen are generally linked with higher rates of depression and anxiety compared to other methods. Birth control, which is a medication that is supposed to be a preventative, has only led to women starting to use antidepressants and feel more anxious every single day. It makes symptoms worse while also bringing new symptoms. The 2023 study stated that there are other methods besides using birth control that do not cause as much anxiety and depression. But still, even today, this medication is getting prescribed to thousands of women. Not only does birth control affect women's mental health, but it can also increase life-threatening complications. According to UCLA Health by Will Houston, he states that research has found hormonal contraceptive pills may increase women's risk of developing illnesses such as cancer, cardiovascular disease, and many autoimmune diseases. A study also showed that 3 out of 9 people who use birth control have developed either a blood clot or can increase your risk of having a stroke by 20%. Birth control is being prescribed daily to women, while women are increasing their risk of having life-threatening illnesses like cancer. You or your loved ones are increasing their risk of having a stroke or getting an autoimmune disorder every single day they swallow that tiny little pill in the morning that their doctor told them that would help. While it is more harmful than helpful, the problem of women getting prescribed birth control every day and experiencing things such as anxiety, depression, and even risking their life with changes of cancer and strokes, which is all linked to a lack of women's research and what it is helping our body rather than hurting it. With exceptional women's research, we would never have this problem of women risking their lives while taking a preventative medication. There is simply not enough research that goes into women's health. That is the number one issue to why birth control is so controversial. The lack of funding and women's research about the harms and overprescribing birth control all ties back to the research. As stated in the article, birth control has continued to fail women, so why is nothing changed? From the website The Conversation, they say continued lack of research and development into women's contraceptives for many reasons. For one, there is little incentive to improve them. In addition, funding bodies are interested in areas that affect all people, not just women, so funding is not being prioritized. Many women will start taking birth control, so many developers may not see improving formulations necessary. Continued lack of women getting prescribed by their doctor for birth control, but they truly do not know the risks. No one knows. That's our problem. Doctors who have a medical degree and are trained to keep people healthy do not even know everything. The article states that women still take it, so they do not need to find improving it necessary. But the whole reason women take it is because they do not know the risks, since research is not necessary. Developers are simply not funding or providing any help for women's research. Doctors also overprescribe birth control for many other reasons because of a lack of research. According to WebMD by Brunilla Mazzaro says, your doctor might suggest you take a birth control pill to help regulate your cycles and lessen your flow, while it can also make your menstrual cycles worse or even irregular. It can also be prescribed for things like acne, PCOS, and endometriosis. The lack of research is making doctors overprescribe birth control for acne and menstrual cycles, while it is only making them worse and increasing your risk of other diseases. The lack of funding and research doctors have and the overprescribing is the reason we need to step up and advocate for ourselves or the people we love. Whether you are a woman or know a loved one experiencing this, we need to act and learn what is best for our bodies. The solution to better women's health and stop the overprescribing of birth control is to speak up and advocate for yourself or your loved ones. If your doctor mentions birth control, ask if that's the best option for you or if there's any alternative options that might be best for your own body. Most of us go to the doctors and just listen to what they recommend and prescribe, but that's not always the best option for the best outcome. You know your body best. According to the website Healthline, titled The Guide to Common Birth Control Myth, states consult with a healthcare professional to learn more about your options. They can help you identify the safest method depending on your individual health history. Asking questions and learning more about the different options in birth control can help lead to women choosing better options that is the safest for their own body. Also, by learning more about your body and what is best for you, will lead to less side effects and risks by just simply speaking up and advocating for your own health. Many of us in this room also believe that doctors just know everything and should know what's best for us and our health. But in all reality, no one knows besides you. According to Banner Health by Stephanie Thurot, she states, sometimes there is a cultural belief that doctors are experts and you're not supposed to question their authority. But when talking to a doctor, it is important that you advocate for yourself and your best interest and not one person knows everything. Bringing up alternative ideas can help your doctor produce ideas that normally they would not have thought about. The evidence shows that most people are afraid or anxious to speak up, to their doctor. But in all reality, you know your body best, and speaking up can help provide your doctor with the right tools to help you. Being honest and bringing up alternative ideas like something different than birth control can help you stay away from these potential life-changing risks and keep you healthy. As we wrap up our solutions, let's go back and recap the things we learned today. This afternoon, we learned how birth control can lead to menstrual and physical side effects, the lack of research and overprescribing birth control, and to speak up and advocate for yourself or your loved ones and that are going through this experience. Next time you hear or read something about taking birth control, think back to what we discussed today and see if you would want to go through those experiences. Imagine your loved ones going through a situation similar to this. Step up and help them with their help. Now, in the beginning, I asked if any of you have heard of birth control. Now, leaving the cedar today, I hope you have a better understanding of birth control and the negative effects it can have on you or any of your loved ones. Thank you.